Good morning, I'm Rachna. So doctor, I'm going to be asking you a few questions about ceramic implants. So what is the difference between ceramic implants and titanium implants?
Well, the difference is very obvious, but sometimes it's hard to distinguish. It's ceramic implants are ceramic, they're metal-free. They're made of zirconia. Zirconia is an oxide of zirconium.
Okay.
So that's where the confusion comes because zirconium itself is a metal.
Yes, yes.
Okay? But once you have oxides of metals, are crystals, they become ceramic. So you call that type of metal like titanium, zirconium, yttrium, those types of metals are called transition metals. So they can be manufactured and transformed into ceramics.
Yes.
Of course, the titanium implants, of course, those are made of alloys.
Yeah.
So it's not 100% titanium, but it's titanium, aluminum, vanadium, and many other metals, but in smaller quantities.
Yes.
So the difference is one is a metal and one is a crystal, it's a ceramic.
Yes.
Okay, so, and that's the differentiator there.
And what are the chances of breakage of ceramic implants over titanium?
Well, that's a very good question because the original ceramic implants, which by the way were not zirconia, they were made of another oxide of metal, oxide of aluminum called alumina. They had a big break. They had a very high rate of breakage. Zirconia itself, 100% zirconia, you'll never find an implant that's 100% zirconia because zirconia is very sensitive to humidity. So, and the mouth is humid, we know that.
Yes.
So that's why you find that the zirconia implants, what we call zirconia implants, are really composites. It's a composite of zirconia, alumina, and yttria.
Yes.
And in that formulation, the fracture rate is not any more elevated than with titanium implants.
And are there any special considerations in placing ceramic implants?
Yes, there are. The foremost consideration is the health of the patient. Unlike titanium implants, or implants, metal alloy implants, zirconia is a material that's bioinert. So it's not going to trigger anything. So with a material like that, you need the body to be able to reach out to the implant, so to speak,
Yes.
and take it in. So your patient has to be able to heal, well, first endure the surgery, and then heal from that surgery. And the faster you have healing, you can have healing happen around a ceramic implant,
Yes.
the higher success rate you're going to have. Well, how does that happen? You have to make sure your patient is healthy. They have to have, their vitamin D has to be good, their cholesterol has to be under control, or not at all high. So there's a lot of systemic issues that you have to check and either optimize or correct
Yes.
if you're considering placing ceramic implants. So it's a little more, it's a material that's a lot more sensitive to the health status of the host. So you have to be a little more diligent and meticulous when you plan to place ceramic implants.
Yes. Are there any biological and aesthetic considerations in ceramic implants?
Well, biologically, like I was saying, one, it's a very inert material,
Yes.
but two, it's also a material that stays very clean. So you see, zirconia has this property that its surface energy is very low.
Yes.
So it doesn't retain plaque. And if you don't retain plaque, then you tend not to have a lot of bacteria. And even when bacteria, well, there's always bacteria everywhere, but when the bacteria when you look at the bacteria population, the microbiota around zirconia compared to titanium,
Yes.
you find that, the ones, you get more cocci around ceramic and you get more spirochetes around metals. And we know spirochetes are a lot more virulent. So, and inflammation causing. So, those are some of the things, amongst many others, that make that zirconia can sometimes be a better option.
Okay. So are ceramic implants possible in all cases, or is it confined to specific cases?
Well, in the beginning, the range of applications was limited because most of the ceramic implants were one piece. So you only had, you could only use it in very limited areas, like premolars, maybe in some cases anteriors and stuff like that. Today, the range, first of all, the range of implants has expanded. The prosthetic components have evolved, and there's a variety. So now you can pretty much do most types of oral rehabilitations with ceramic implants. Posterior, anterior, quadrants, singles, full arch, full mouths.
Okay, that's wonderful. Thank you so much, doctor. Thank you so much
welcome.
for your time.
You're welcome.